Good day. Welcome to Asoka Services YouTube channel. In this channel, we try and translate health policies into data or information that everyone can understand. In this video, we'll be looking at the national indicator datasets. We'll look at how these datasets are formed, what is the basis, why are they there. We look at the purpose that they are supposed to address, why are they there, who needs them, why, and we look at the data elements and the indicators that make up these datasets. The National Health Act is an act that is based on the constitution of the country. It tries or it aims at structuring the health system so that it's standard or it's provided in the same way throughout the country. The Health Act is provided or is translated into health policies for each programs, and these policies then assist in achieving the health goals of that country. The Public Finance Management Act is an act that is put in place so that it's put in place so that it regulates or it measures or it controls the use of resources, assets that the government has. It helps with management of these assets within every health institution, as we know that all government institutions get funding from the public finance. So this PFMA helps all the institutions or keep all the institutions aligned so that they provide services and use government funds with responsibility and as effective as possible. Based on the PFMA, we have district health information system that needs to be developed. These systems make it possible for us to measure what we have done with the funds, and it makes it possible for us to see where we are lacking or where we are overspending or underspending. And in this district health information system, then we get the national indicator datasets. These are minute or measuring tools or measuring systems that are in place so that we can account to the PFMA as well as the Health Act. Let's look at the National Health Act as to what it says around development of the health information system. So in section 74, it states that the National Department of Health needs to make sure that there is a national health information system, and this system is maintained at all times. And this system, in our case, becomes the district health information system. In section 74, it also states that the minister needs to prescribe on what kind of data needs to be collected and in what format that data needs to come in and who's supposed to collect that data. The FMA, as we have said before, tells us that we need to report on a quarterly basis on performance to monitor what we are doing with the funds or assets that have been seconded to the department, and also evaluate the performance and monitor it if we are in line with the set targets. If not, then we are reliable. The accounting officer in each establishment is reliable to put corrective measures in place. For us to be able to monitor this on a quarterly or even monthly basis, we then need the district health information system. It also says that the PFMA also says that we need to submit on an annual basis all the activities of the department as an annual report, as well as the financial statements, audited ones, and the Auditor General statements are also submitted. This is all in a way to account for the use of funds. National indicator datasets then becomes very crucial in our case, so that because it gives us a leverage to be able to track our performance and be able to draw on reports when we need them. The National Department of Health then is responsible for the development of the needs. It also monitors how these needs are done, how they are used, it leads, because the NIDS, the National Indicator Dataset, is made up of data elements and indicators. So National Department of Health then leads in making sure of analyzing the development of the indicators and the data elements. They also make sure that these elements are aligned to the health goals and objectives for that period. Remember, these health goals and objectives are expressed in our guidelines. In any of the health guidelines that you see, it will give you the goals for that term or for that program. So those goals needs to be measured then by the use of data elements and indicators and through the development of the health information system. NIDS, the data sets themselves, which is the indicator and data elements, are reviewed and communicated as such every 2 years. This makes it possible then to make sure that they are aligned to the program or to the health goals as they change. There is no parallel reporting that's supposed to happen. Only those NIDS that are supposed to be used by all health establishments to report. Let's look then at what is the indicator and the data element. What is it that we need to expect from them? The data elements must have, with every 2 years when they are reviewed, the data elements must be defined in a way that all healthcare personnel can understand, and it needs to tell us that how are we supposed to collect it, which point, which tools are they supposed to use, and they're supposed to provide all of these. The data elements are what the facilities collect. Is the day-to-day activities that facilities do being measured on those data elements. So it is collected by the facilities, and we have indicators. The indicators basically are not collected by facilities, but indicators use data elements for measurement. So without data elements, there will not be any indicators. So indicators also will have a definition. They will have a formula that will tell us what is used to measure that data element, which data elements are used to measure that indicator. And they will also have a collection tool, the method, and responsible people. Let us then look at the examples of these data elements and indicators. Let's take the PHC head count under 5 years. The definition is that it's all individual clients not yet reached the age of 5 years that are seen in the PHCs accessing the healthcare services. This data element is used to measure or monitor access and utilization for children under 5 years. It is collected on a monthly basis, but it is collected daily as the services are being rendered. We'll look at the tools in another video that will show how we collect this data on a daily basis, but it is reported monthly to the health information system. The data element is collected by the receptionist or the data clerk. This is when the patient comes into the facility and they would go and collect a folder. This is where this data element is collected. So you will notice that there is a trend that data elements are collected at the point of service. At this point in time, the patient is fetching a file, so they collect their files at the reception. So the head count will be collected at the reception. Collection point, it is the PHC facility. In other words, the PHC head count cannot be found at hospitals. It will only be found at PHC facilities. And it is collected daily at the reception head count register or the HPRS. So those facilities that are counting their head count electronically will be using the HPRS. If the HPRS is not at facilities, the daily reception head count register will be used. We'll look at these registers in the next video. Let's look at the data element then. Remember, we said data elements are calculated from, let's look at indicators, and we said these are collected using, are calculated using the data elements. Then the data element that we looked at was the PHC head count under 5 years. The indicator that we look at is PHC utilization under 5 years, right? So the definition is there. It calculates the average number of PHC visits per year per person under the age of 5 years in the population. In other words, it takes this child and put them in the population that the clinic is servicing, which is the catchment area for that clinic. So the indicator takes the population into account. The data element was counting only that person as they come to the clinic. So to calculate this, the numerator will be the PHC head count under 5 years, which is what we looked at in the previous slide. And the denominator will be the population under 5. This population will add both the males and the females in that population or in that community. We use this for the context to access, to monitor the access and utilization of children under 5 years of age, how they're accessing this clinic and how often in line with the number of population against the population of that age in this population, in this community. So it is also collected monthly, as the data element is fed on a monthly basis. The indicator can also be calculated on a monthly basis. This shows data elements and indicators that the national indicator data set for 2020 has. You will notice that if you look on your left, that the data elements or even indicators are recorded into groups like your art monthly, your CCMDD, your child and nutrition. Under those groups, there is a number of data elements or data sets. The art monthly, which is the first one, has 4 data elements. Out of those data elements, we are able to calculate 2 indicators. If you look at the bottom, the women's health, it has 13 data elements. Out of those, we are able to calculate 5 indicators. You will see that the ones on the left are collected on a monthly basis, but we also have those that are collected on a quarterly basis, some that are collected at special events like your campaigns. If you look at your right, you will have your art quarterly indicators, your TB, your routine non-facility ones, as well as your campaign ones. Out of those, you can see how many we are collecting. Out of each group for your art, we have art baseline group that has 4 data elements and 29 indicators from those. Your periodic campaign ones, EPI campaign, we have 10 data elements that are reported on, and 17 indicators come from those data elements. So the national indicator dataset provides us with a group of data elements and indicators that we can use in measuring the facilities as to how it's going as far as the community using them, or how we manage the facility, which is your management PHC data element, as well as how we are rendering our healthcare systems, how we're implementing the health policies that the Health Act is trying to achieve. And it also gives us leverage to be able to report on the PFMA quarterly, monthly, and also monitor performances and be able to create improvement plans. So in this video, we have looked at the basis, why do we have the NIDS, and we looked at the acts that it is based on. We looked at the DIMS policy, as it is the one that houses the NIDS as a whole. And we also looked at one example of a data element and a data and an indicator. So in the next video, we'll look at the collection tools, because it does not make sense for us to have and understand the NIDS without knowing how are we going to collect them, and also knowing the tools. So please subscribe to my videos so that you get a notification when a new video is released. You will find a red button under this video. Please press that button. There's also a like and a share option. Thank you for watching this video. See you in the next one.